Hello, and welcome to Updating Electronic Health Records to Address Nicotine and Tobacco Use Dependency Treatment, a virtual training from Constellation Consulting, June 2022. All references to tobacco and tobacco products within this presentation refer to commercial tobacco and nicotine-containing products, and not the tobacco plant or other plant mixtures grown, harvested, and used by American Indians and other indigenous peoples for sacred purposes. On the screen are activity disclosures in accordance with the policies and standards of the Greater Albuquerque Medical Association, the New Mexico Medical Society, the Accreditation Council for Continuing Medical Education, and the American Medical Association require that speakers and planners for continuing medical education activities disclose any relevant financial relationships that they may have with commercial interests to products, devices, or services that might be discussed in the content of a CME activity. During this activity, updating electronic health records to address nicotine and tobacco dependency treatment, I will be your speaker. I'm also a planner for this activity, and I have no financial relationships with any commercial interest related to the content within this activity. I also have no actual or potential conflicts of interest, and we would also like to acknowledge that this activity was planned and supervised by Constellation Consulting and is supported in part by a grant from the New Mexico Department of Health Nicotine Use Prevention and Control Program. Again, my name is Rebecca Padilla. My pronouns are she, her. I am a certified tobacco treatment specialist, and I'm also a national manager for tobacco programs with the American Lung Association. I'm excited to talk to you today about some EHR updates and modifications that can be done within systems, big and small, across New Mexico to help enhance and integrate evidence-based tobacco treatment services. On the screen today is our agenda. And with that, we will get things going right away. We have a lot to discuss and a lot to go over. So in the first section of today's training, I want to give you a really good general overview of health systems change strategies, some key elements of health systems change, and how we can use those key strategies to help integrate nicotine and tobacco use treatment services. So we're going to look at key strategies, at coverage, meaningful use of EHRs, quality metrics, and we're also going to briefly touch upon community hospital needs assessments and community benefits in relation to tobacco treatment services. So we're going to get started by looking at health systems change strategies. I'm not going to dig really deep into the foundation of why it's critical and important to address tobacco dependence in the US and in New Mexico. If you're interested in a foundational training on the importance of addressing tobacco product use, on providing care for folks that may have tobacco or nicotine dependency, the American Lung Association, the Nicotine Use Prevention and Control Program here in New Mexico, and Constellation Consulting all have some wonderful foundational trainings that are available on demand to give you a good grounding and good background information on why this is such an important topic to address in medical and behavioral health fields today. Tobacco use is still the leading preventable cause of disease and death in the United States, and it's a significant driver of healthcare costs. And more than 16 million people in the US live with at least one serious disease that is caused by or linked to tobacco product use. And we know that future smoking-related illnesses can increase costs that can be prevented by individuals who use tobacco products by helping them quit today and by preventing their future use for young people across New Mexico and across the United States. So what we're going to look at today is integrating those evidence-based treatments that we know work effectively to help people recover from nicotine dependency. And that includes cessation counseling with an evidence-based cognitive behavioral change program, and utilizing FDA-approved quit medications, or that medication-assisted treatment, to help ease those recovery symptoms people might experience as they're quitting these products. So that's really what we're talking about integrating today. So when I talk about tobacco treatment integration, it is kind of that 1-2 punch that we know really works effectively to help people recover. We're talking about both cessation counseling and medication-assisted treatment services. So please keep that in mind as we go through today's training. So when we're looking at integrating those two key components, cessation counseling and treatment, using FDA-approved quit medications, we're looking at a few key areas to really help have a comprehensive door-to-door integration of these proven effective services. So when we're thinking about health systems change strategies, a lot of these components are universal. First of all, that key foundation, gaining buy-in for a tobacco product-free culture within an organization, is critical. Also, making sure that those tobacco-free policies are in place from an organizational perspective to ensure that staff, patients or clients, visitors, vendors, and more are all being addressed with the tobacco-free policy that is in place in an organization. And this is critical, whether your organization is one provider or hundreds. It's really critical to have those key organizational policies in place. Secondly, it's also just as critical to equip our care teams to provide tobacco treatment and to adhere to tobacco treatment best practice guidelines. So when we're talking about care teams, we are talking about the entire staff at an organization. And again, doesn't matter if it's a solo provider or a large multi-state or multi-region health system. It's important to have all levels of the care team integrated and buying in on providing treatment for patients. And we also want to look at a standardized screening process. And that's something we're going to dig into today, because this is really where the electronic health record is key. So making sure that we're standardized screening of all patients, that we're following best practices, that we are aligning our screeners with comprehensive language, with making sure that we are addressing quality measures and key standards that we want to make sure are adhered to with every patient at every point of contact. We also want to make sure that protocols are in place that include evidence-based treatment. So streamlining workflows, making sure that we have reminders and best practice guidelines fully integrated throughout workflows is another key critical component of modifying electronic health records to support this work. And finally, we want to make sure that we are providing consistent referrals for treatment and cessation counseling, and that we're following up. And again, this is a unique area where the electronic health record can fully support integrating in the referrals and the follow-ups. So I could spend an hour plus just going over any one of these key strategies. But instead of that today, I want to recommend that you look into the tobacco cessation change package, which was developed with the CDC and Million Hearts. And this is a really great toolkit. It's extremely comprehensive. It follows best practice guidelines and clear-cut evidence base using road-tested proven strategies from across the nation. And this resource is really relevant to help healthcare professionals and their teams on integrating, and it works in any setting, whether we're talking inpatient, outpatient, ambulatory care, behavioral health, or adjunct wraparound care with community organizations that might be providing additional services to community members. So we will be sure that we link this in the additional resources. There'll be a QR code at the very end of the training where you can access all of these slides with links. So stay tuned for that. But if you want to dig in deeper to those key foundation strategies, this is really the best resource that you can access out there. And it's got all of the key elements that you need to get those front door to billing practices in place within your system, regardless of the size. Whenever we're talking about using electronic health records within medical settings or behavioral health settings, certain words are going to start to come up. And again, I could spend an hour plus talking to you about any of these key topics. So we're just going to briefly touch on this, and I'll give you some recommended resources if you want to take a deeper dive. And one of those key topics is meaningful use. So meaningful use is an electronic health record incentive program that is run by the Centers for Medicare and Medicaid Services, or CMS. And basically, in a nutshell, it provides a financial incentive for meaningful use of a certified electronic health record technology to achieve health and efficiency goals within health systems. So it's got some primary overarching goals here, mainly improving quality, safety, efficiency, and to reduce health disparities. Another goal of meaningful use is to engage both patients and their families, care providers in comprehensive healthcare services, to improve care coordination. And we're going to talk a little bit more about that later in the training today, but to improve that care coordination between different care providers, different settings, and to integrate population level and public health into primary medical care. And then finally, it helps to support the maintenance of privacy and security of patient health information and data. So again, lots to understand, to learn about this. This is a very quick overview of what meaningful use means. Another key term that we talk about when we're looking into electronic health records is quality measures or quality metrics. And there is a tobacco performance measure set that is related to this, that is aligned with the Joint Commission standards. And they developed the tobacco performance measure set to include 3 standardized measures. So basically, that's tobacco use screening of patients 18 and over, tobacco use treatment integration, including counseling and medication during hospitalizations, and tobacco use treatment management plan upon discharge. So this is Joint Commission standards. So we're talking about inpatient hospital settings here. However, this can be very relevant when we're talking about EHR modifications and use in other settings, and standardizing the screening across different settings in larger systems. So I do have a couple of recommended resources. Again, these will be provided to you at the end of the training. However, primary one is cms.gov. That's the Centers for Medicare and Medicaid Services, and really can dig deep into all of the guidelines there, the technology that is warranted underneath meaningful use, etc. So all of the regulations and guidance are available on cms.gov. Additionally, my teammates at the American Lung Association just rolled out this month in June of 2022, just rolled out a great new technical assistance support package around tobacco cessation quality measures. If you take your smartphone or your tablet right now, open up the camera app, scan that QR code that's on the screen, you can access that Tobacco Cessation Quality Measures Matrix, and it's a really good reference and technical assistance guide. So that's a really quick snapshot of a couple of key terms to just be aware of when we're thinking about electronic health record modifications. And so moving on to the real primary topic of today's training, looking at leveraging our electronic health records to support cessation integration. So I'm going to keep referring to this as an EHR throughout the training today. However, some folks might refer to this as an EMR, an electronic medical record, might call it a health record, different words. There's different platforms that are used. I'll give you a few examples with screenshots of them today, but just know that EHR is being used as kind of the catch-all term. And when I'm saying EHR modifications, this might be using Meditech, it might be using Epic, it might be using a whole other platform that maybe is just rolling out right now. So please understand that these are very general guidelines, and I'm going to talk to you about how you can get support for your specific system a little later in this training as well. So there's a few key steps when we're looking at integrating and modifying and enhancing EHRs to support tobacco cessation. So what we're looking at is, number one, that we are making modifications that support tobacco use screening guidelines. Number two, that we're building in some sort of trigger mechanism that will trigger a cessation consultation for those patients that are screened positively for use, meaning that when they're asked, do you smoke or vape or use other tobacco products, and they say yes, there is a mechanism to do an intervention or a consultation to help support those patients in quitting. Thirdly, here, we're looking at a trigger for FDA-approved cessation medications. So this is where those best practice alerts, those provider alerts can pop up. There's a lot of really cool things that we can do within different systems to make sure that providers are offering the FDA-approved medication-assisted treatments to help patients recover from tobacco and nicotine dependencies. And then finally, another kind of best practice to leverage your EHR to support this treatment is to make sure that there is a referral mechanism in place for a referral to the quit line if you don't have on-site cessation services. So of course, in a perfect world, with unlimited staffing and funding, we would love to have a certified tobacco treatment specialist at every large health system, in every mid-sized health system, even in those smaller community, very focused solo or, one or two provider systems. We would love to have someone that is dedicated to provide evidence-based cessation counseling and to make referrals for medication-assisted treatment. However, we know that that's just not feasible in every setting, in every system, every time. So using the New Mexico State Quit Line, or if you're watching this in another state, your state's tobacco quit line is a great adjunct care provider to really help to enhance and sustain opportunities to provide care for patients, specifically when it comes to cessation counseling or access to NRTs. We'll talk more about using the quit line referral mechanisms in a few minutes, but these are the 4 key steps that we really, really want to see big systems, mid-sized systems, or solo providers integrate within their workflow to make sure that they're providing the best care possible to their patients. So looking at a few different types of electronic health record modifications that are going to help to optimize this integration of tobacco cessation services. So a couple of things we're going to look at. We're going to look at a few examples of different EHR platforms and order sets, some provider alerts. Then we're going to look at eReferrals and other referral processes that can be integrated depending on the system you're using and depending on your capacity. So looking at a few key steps to leveraging your EHR, again, outside of those 4 best practices is, making sure that you're bringing all of the right key players to the table to discuss this. So thinking about getting buy-in from leadership and administration, the IT experts in your system or in your organization, quality improvement and patient safety managers or teams, those experts in billing, and the healthcare team. Oftentimes when we're thinking or when we first start promoting tobacco cessation services and tobacco treatment, we instantly think of those providers, right? They're the ones that can prescribe the medication. They're the ones that see the patients. They're trusted by the patients. But we know it takes the whole neighborhood to make sure that a person is cared for. And this is really a comprehensive strategic approach that is going to ensure success in integrating these treatment services. The other thing you want to do is you want to make a strong case for why this is important. We know it's the right thing to do. We know it improves health outcomes, but it can also help streamline workflows. It can prioritize treatment. It can make it easier for the patient to control their chronic diseases. It can also help to prevent those poor health outcomes that we see from continued tobacco product use. And it doesn't have to be difficult. We can make it very easy on providers and their support teams on integrating and streamlining these treatment protocols. And finally, the other thing you want to look at is building a workflow, enhancing a workflow, following a proven system like the 5 A's or AAR, which are evidence-based brief tobacco interventions. And if you want more information on those, again, I'm going to go back to American Lung Association, our friends here at Constellation Consulting, and the New Mexico Nicotine Use Prevention and Control Program. We all have trainings available on brief interventions that are on demand and no cost. So you can access any of those. We'll have links to all of them at the end of the training as well. Additionally, referring back to CDC and looking at their brief interventions, we all use those best practice standards of using evidence-based tobacco treatment guidelines, and that includes the 5 A's approach or the condensed AAR, the Ask, Advise, Refer. Also using things like clinical decision supports. You're going to see a few examples of that in just a moment. That can really help streamline things for integration and enhancement of workflows here. Looking at integrating resource materials and referrals, you don't have to build this from the ground up. There's lots of great organizations available that have ready to go, ready to upload patient education materials. There are referral systems in place already through the Quit line and through, folks like our Freedom from Smoking facilitators that are trained in an evidence-based cessation modality, like Freedom from Smoking through the American Lung Association. There's lots of great systems that are already in place. It's just a matter of making sure that we're using these systems that are in place. And then finally, arranging for follow-up. It doesn't have to be hard. This is where we go back to leveraging the EHR and making sure that the modifications and enhancements that are happening to those electronic health records are efficient and effective to help streamline all of these processes. So moving forward and looking at our first example of a real life electronic health record that has a really great screener in place. So this platform is Meditech. It's one of many different certified electronic health record systems. And you can see here a good example of a comprehensive screener that's in place. So here we can see smoking status of, if they're a former smoker, a current smoker, never smoker, how heavy their tobacco use is, how many cigarettes are they smoking every day. But I want to bring your attention a little further down, and you'll also see within the screener here that there is the opportunity to document if the patient uses dip or chew, if they're using any other tobacco products, and if smoking cessation education was provided to the patient. So this is one route of documentation that is critical, and we'll talk about why it's critical in a few minutes, but it's critical for billing and for other documentation purposes. This is a great example of a comprehensive screener. Another option here for documenting tobacco treatment services and EHR integration. This is a more simple kind of basic notation system. And here we can see where a respiratory therapist documented that they did a consult with their patient in an inpatient setting. Something I just want to draw your attention to is right up top. It says tobacco education status and tobacco counseling of greater than 3 minutes, tobacco counseling of greater than 10 minutes, or refusal of counseling. So remember this for a moment. I'm going to come back to it in just a few minutes and tell you why this is critical and important that it's documented within our EHR. And again, very simple, easy to use system here. You can click the check boxes as to whether cessation handouts were given, education was completed, if NRT was provided, or if orders were requested for a prescription. Another great example of a comprehensive EHR modification here, this platform is GE Centricity, but these modifications are relevant to all systems, just kind of looks a little different depending on the platform. But if you'll draw your attention to that highlighted circled yellow portion of the EHR here, you'll see that this EHR system fully integrates screening for vaping devices and e-cigarettes. Unfortunately, the tobacco industry has spent millions on expertly marketing their products, from cigarettes to e-cigarettes. And many times patients have the misunderstanding and misconception that an e-cigarette is somehow different than other tobacco products. And we know that it's not. We know that it increases and sustains dependence on nicotine and tobacco products. We know that patients that use these commercial tobacco devices are more likely to use combustible cigarettes. They're more likely to use what we call dual consumption, which is using more than one type of tobacco product. They're more likely to have higher levels of nicotine dependency because a lot of times they are, using these vaping devices that hand to mouth with the device multiple times an hour. And it's really, a lot of them don't even know how often they're using it because it's so insidious. So critically important to have the opportunity to screen patients about their use and give them that education that, they are using a tobacco product when they're using those e-cigarettes. A lot of times when we screen patients and ask them, do you smoke? They'll say no. But if we ask them, do you use e-cigarettes? They might say, yes, I quit smoking using an e-cigarette. And we know as tobacco treatment professionals and experts in this realm that Again, that is not quitting. That is not recovery. That is just switching to a different commercial tobacco product. So critical here, critical opportunity, especially when we're looking at serving younger folks in the community that may have that misconception, again, that e-cigarettes are safer somehow and don't have the same health outcomes that other tobacco products do. So again, this screener has, all of the information that can be documented on referrals for cessation, consults, or medication-assisted treatment orders being sent for fill from the pharmacy. Another really popular EHR platform system is Epic. This is a great example of an eReferral within the Epic system. I do want to say that all of these screenshots are provided to us by our friends at the Oklahoma Hospital Association. They have some great resources. I'll tell you about them in a few minutes and give you the link to those as well. But they've been kind enough to share these really good general screenshots that don't have any protected health information within them. So I just want to give that little caveat. So with this, within this particular system, there is an integrated e-referral within the state quit line. So depending on the system, on the state, there are different capacities for referrals to state quit lines. So there can be a fax referral, there can be a web-based referral, there can be an electronic medical record referral or that e-referral through the system. Sometimes there's even bi-directional communication depending on the system and the state. So a lot of this is very not cookie cutter. Each system has unique capacities to it, and that's where it's really critical that you work with your IT professionals within a system, that you engage with the folks at NUPAC here in New Mexico with the Department of Health, or if you're in another state, looking at your state Department of Health or public health department's tobacco control program. Each state has one, and they're really the experts on best integrating with the state quit line. So looking ahead again, this EHR example from the Oklahoma Hospital Association, a great example here of a comprehensive screener that takes it through screening all the way through cessation consult, getting a referral in place, prescribing those FDA-approved quit medications, and then also documenting for a referral and follow-up. Critical components, best practices. And zooming in on our beautiful state of New Mexico here, our 1-800-QUIT-NOW or Quit Now New Mexico, quitnowinm.com. That is our state quit line, and they provide some amazing services, both for providers within health systems and for patients and community members that they serve. So on the screen is an example of the quit card. This is the easiest way to integrate cessation services within your practice, is to have quit cards available in your exam or consultation rooms, in your therapy rooms, in the front office, in the bathroom, all over little different spots of contact that you can provide these for patients. And oftentimes you don't even have to do a formal intervention. You'll start to see people will just, take one of these and put it in their pocket or their bag, oftentimes to sneak to a loved one or to call and kind of see what exactly the quit line is all about. And it's a very low risk intervention, meaning that, it's not stressful usually for the patient or the client to engage with these quit cards. We've seen them around. So you can get these at no cost through the quit line. Also on the screen is the fax referral. So a lot of times people that are newer to working within electronic health record systems are a little confused as to why fax referrals, fax anything is even a thing. It is 2022. Why are we using fax machines? Well, the simple answer is interoperability between electronic health records. And that means very plainly that different systems, as of right now, can't fully talk to each other in a way that protects patient health information. So in order to be HIPAA compliant, oftentimes we need to use fax communications between providers, between different referral systems in order to ensure patient privacy and protected health information is fully protected until we can get to that point in the future, hopefully sometime soon, that different platforms, different systems can all work together and communicate in a way that protects patient privacy and security on their health information. So again, the recommended resource here is the NUPAC New Mexico team. So that's the Nicotine Use Prevention and Control Program through the New Mexico Department of Health. So these folks are really experts in helping support providers, in helping support health systems, big and small, in making sure that they're following those evidence-based tobacco treatment guidelines to best support their patients and ensure that they're providing good, efficient services to help their patients recover from tobacco dependency. Again, they work closely with the state quit line. They can get you set up on quit cards on how to use or web-based referrals or how to do a fax referral so that your patients are being served. This is also a great way to increase capacity to provide these services for those smaller provider practices. You know, it might be a solo provider, whether it's medical or behavioral health. This is a great way for, you know, those folks that think, I have such a limited amount of time with the folks that I serve, with my patients or my clients. I don't have the capacity or the resources to provide cessation counseling. Guess what? The quit line can help fill in that gap for you. So definitely highly recommend that you reach out to them, reach out to these folks, or reach out to us at the American Lung Association or at Constellation Consulting. We can all get you in touch with the experts that you need to help support you in this work. So going back for a quick review here again, these 4 key components are what we're looking at when we're leveraging our EHRs to support cessation. Tobacco use screening guidelines, every patient, every time. We're screening for all tobacco products being used. We're screening for a complete history on tobacco product use. Once those patients are screened, if they are screened positively, meaning yes, they have answered yes to using one of those tobacco or nicotine containing products, that there is a trigger for a cessation consultation. Whether that is a brief intervention that we know is proven effective to help patients quit, or it's a more intensive consultation for cessation counseling and medication-assisted treatment, that there is a trigger within the system to help prompt providers and their care teams to initiate that consult. Following up on that is a trigger for those FDA-approved quit medications that we know have an evidence base for patients to help them quit. And we're looking at the 7 FDA-approved quit medications here. So there's really 2 different types of quit medications that are designated for cessation. There's the short-acting medications and there's the long-acting medications. Some can be combined for those patients that are a little bit more resistant, that might be really encountering some real challenge in quitting, might be experiencing those recovery symptoms at a heightened degree. We're talking about those folks that are heavy, you know, product users that are using the vapes with a cigarette, are smoking perhaps 2 packs a day, have been smoking a pack a day for 30 years. Those really tough cases can really be supported effectively by using combination therapy. So we'll talk about that more in just a moment. And then finally, that fourth step is the referral to the New Mexico State Quit Line. Even if you have good capacity, you have these best practices in place, you can still refer patients out to the quit line for additional support. There's text services that are available, there's phone services that are available, and these can complement the services you might be providing within the setting that you work in, and can just further support those patients on their road to sustained recovery. So looking at coverage is a key component when we're thinking about providing care to patients. And I just want to give a quick little caveat here that this training is specific to folks in New Mexico. That doesn't mean it's not relevant to folks all across the nation, in our sovereign nations, and as well as our US territories. So a lot of this information is relevant regardless of what state or community you're in. However, these next few key points are relevant to New Mexico. So one of the great things about our state is New Mexico offers comprehensive barrier-free access to tobacco treatment. And that includes coverage of all 7 FDA-approved quit medications. So again, talking about those short-acting and long-acting medications, some of which are available by prescription, some of which are available over the counter. So we're thinking about nicotine replacement therapy in the form of the patch, the gum, or lozenge, as well as nicotine replacement therapy through the inhaler or puffer, and nicotine replacement therapy through the nasal spray. We're also looking at the prescription medications that are known to be effective in helping people recover from tobacco dependency, like varenicline and bupropion. So Chantix or Zyban are the commercial names. Both medications are available in a generic form. And again, all 7 of these medications are FDA approved and are covered in New Mexico under New Mexico Medicaid. It's important that we're talking about New Mexico Medicaid patients here because we know that Medicaid enrollees across the board, across the country, have nearly double the smoking rates of the general population or the population that might have commercial insurance. So it's really important that we have these comprehensive services in place and coverage in place. Additionally, in addition to those FDA quit medications, New Mexico also covers cessation counseling, and that includes multiple different provider types. And we'll talk a little bit more about this in a moment, but multiple provider types is also key to making sure that we're removing as many barriers as possible to access, so that, whether a patient is seeing an MD, or they're seeing a nurse practitioner, or they're seeing another licensed healthcare professional under the guidance of one of those prescribers or care providers, that they're able to get access to the education, the counseling, and the medication that they most need. And finally, no co-payments or stepped therapy in New Mexico. We do not have prior authorization requirements in New Mexico, and there are no lifetime limits. So again, all of these are critical components to providing comprehensive tobacco treatment services to our community. If you would like to learn more about coverage in New Mexico or compare coverage between states, or perhaps you're joining us for this training from another state, you can access up-to-date coverage information and learn more, compare states through the American Lung Association's State Cessation Coverage Database. Again, if you take your smartphone or your tablet, open up the camera app and scan the QR code that's on the screen, you will jump directly to that database. This will also be included in our slides available to you at the end of this training. So going back to who can bill for cessation in New Mexico. So I've got a little chart here on the screen that might be helpful to you to look at. There is a little disclaimer at the bottom in fine print, and that is basically, when in doubt, talk to the insurance payers that you are contracted with, talk to the folks in your billing department to find out what their experience is, what their recommendations and guidelines are around billing. But general guidance is on the screen as far as it goes with coverage for Medicaid and Medicare. So, these are our most disparately impacted folks in the community that are Medicare and Medicaid recipients. And thankfully, in New Mexico, we have good coverage policies in place, and that includes provider types that can bill for services. So billing, when we go back to looking at EHR modifications, there is a direct, clear line of sight to billing. And the reason we want to have all of these EHR modifications in place is so systems providers can bill if they wish to. So a few minutes ago, I pointed out a key component in one of the EHR examples that I showed you on the screen. Do you remember what it was? Hopefully you're shouting out right now that it was that time frame of the cessation counseling that was provided, or the consult that was provided. So if you remember, that EHR screener had consultation greater than 3 minutes, consultation greater than 10 minutes, or patient refusal. The reason that that's critical is because it aligns directly with documentation needed for coded billing. So on the screen is the most common billing codes that we use for billing for cessation. And this isn't, the end all be all for every system, for every provider type, for every state. But these are the most commonly reimbursed codes. And this is code 99406 for those brief cessation consults between 3 and 10 minutes. Over 10 minutes is 99407. And then when we're looking at providing group counseling for cessation, there's 99078. So again, you'll want to check within your state, with the system or the payer that you're contracted with, what is covered specifically and which providers can bill. But general guidance, these are the primary codes that are used in medical care settings. And you'll notice on the far left of that little table is the routine care kind of clause there. So if a consult is deemed to be less than 3 minutes, very, very brief, it's considered to be routine clinical care. So we're going to loop back to this routine clinical care, though, in just a moment, because there's another key component here that I want to talk to you about that might be important to your practice or to the organization that you work with. Again, the American Lung Association has some great resources available to you. We have a billing guide. You can access it by scanning that QR code. It'll also be made available at the end of the training that really goes into depth on some key considerations around billing for tobacco cessation services. But let's think about for a moment, is billing for payment the only reason we want to integrate cessation? Well, of course not, right? We know it's the right thing to do. We know it helps people be healthier, happier, and live longer, more productive lives. It also saves overall on healthcare costs in the long run. However, there is another key consideration here when we're looking at integrating and modifying our EHRs to include cessation services, and that is community benefits, or benefits for nonprofit systems. So This is another topic that we could dig really deep into for an hour plus. There's a lot to learn with utilizing community health needs assessments and looking at how nonprofit systems use community benefit calculations to help sustain and maintain their nonprofit status. So basically, hospitals and these systems, they have a really important role to play in our communities. And one of the ways that they do that is through the community benefits that they provide that aren't reimbursed upon. And that is how they are deemed to be a nonprofit. That's how they maintain that tax status of being a nonprofit. So there's a few ways that tobacco cessation services, tobacco treatment can be counted on as a community benefit. And on the screen, you'll see a table that breaks out how clinical services, inpatient and outpatient tobacco treatment services can be counted towards that community benefit. The key here is it's not being reimbursed upon separately. So remember a moment or two ago on that table that said any intervention less than 3 minutes wasn't billable, may not be billable, but it can be counted towards community benefit if it's documented. Additionally, those inpatient hospitalizations where patients might be getting a consult or might be provided with cessation counseling, can't bill for that separately, but it can be counted towards community benefit. Also looking at community events like providing no cost group cessation classes for staff, for patients families or community members is another key critical component that can be counted towards community benefit. Also providing no cost medications. Another great way to count that benefit to maintain nonprofit status. So a couple of great resources to dig in deeper into all of the ins and outs of using a community health needs assessment within a system of calculating community benefit with tobacco cessation are on the screen right now. So scan the QR codes. The guidance on the right, the American Lung Association's Hospital Community Benefits and Tobacco Cessation Toolkit, is a great foundational introductory primer to everything you need to know about community health needs assessments, how they work, how they're done, how to get more information on the community health needs assessments in your area, and how tobacco and tobacco treatment services relate to those health needs assessments. Once you've gotten that good foundation, check out the resource on the left. That's from our friends at the Oklahoma Hospital Association. They have a fantastic toolkit and calculator. And the calculator is really easy to use and can help calculate the benefit of providing those evidence-based treatment services within a system. Again, leveraging connections to the quit line, to the folks at the health systems change team within NUPAC here in New Mexico is another great support system that can help you work on leveraging cessation services, understanding how your EHR can help document key components for calculating community benefit and more. I also want to say a really cool additional value addition from working with the state quit lines, whether you have a fully integrated eReferral platform or you're using those fax referrals, is the quit line can provide metrics, ready to go reports on the amount of patients that are being referred to the quit line, and can really help bolster that documentation for community benefit if that is the route you're taking towards integration. Finally, we're going to look at a few opportunities for additional system enhancements when it comes to tobacco cessation. So a few more key topic areas here, looking at whole person, whole health neighborhood approach. We're going to look really quickly at integrating additional services such as patient education and lung cancer screening. And then really just want to touch upon a couple of key components to partnering for real sustained success here. So first of all, the whole person, whole health approach. Many of us are familiar with this when we talk about care coordination. So looking at addressing the whole person with multiple connections in the community. This can help promote economic stability. It's done through educational access and quality education, healthcare access and quality, a neighborhood or a built environment that sustains healthier living habits, and also addressing social, cultural, and community contextual needs. So what we're going to primarily look at here is from a care coordination perspective, and that is looking at the unique settings that we have the opportunity to work with when we're using that whole person, whole health model. So thinking about integrating cessation services, interventions, screenings, opportunities for referrals to treatment in a lot of different settings that people have access to. Looking at pharmacies. In New Mexico, pharmacists have the opportunity to work with patients to get them those FDA approved quit medications. Pharmacists here have standing orders. We were one of the first states in the nation to have that. And it's a great opportunity for patients. Oftentimes they see their pharmacists on a monthly basis, if not more often. Oftentimes they see their pharmacist more often than they do their primary care provider. So pharmacies and their staff have the opportunity to do those brief interventions, to get medications and services in place to make referrals to those evidence-based cessation counseling services as well, like the Quit Line or Freedom from Smoking. Additionally, dental and oral care providers, this is a great opportunity for them as well. Oftentimes, they have an opportunity to address tobacco product use from a whole other perspective. And oftentimes they have the unique opportunity to address this with younger people that might be using vape devices and not understanding the impact that it could have on their oral health, on their physical health, on their looks. So there's lots of cool ways that we can integrate in dental and oral care settings. Also looking at quit lines, leveraging those in behavioral health settings, from substance use disorder treatment centers to residential centers to behavioral health counselors, lots of opportunities here. And finally, community health centers, or those community organizations that provide additional services like housing support, or support for pregnant people, or support for young children and their families. There's lots of different opportunities here where we can engage and integrate those opportunities to provide people with treatment. And finally, looking at a couple of different EHR integrations here. So these are two topics that, again, we could dive deep into, and maybe we will in the future if you're interested. But looking at integrating patient education. So perhaps your patient isn't quite ready to quit, or they might have a loved one that is using tobacco products around them. EHRs now have the capacity to integrate in patient education materials that can outline services that are available to them in the community. So information on the quit line, information on community-based services, information on the impacts of smoking or vaping or exposure to secondhand smoke or secondhand aerosol, or chronic disease specific information and how it relates to tobacco product use. So information on how tobacco products impact people with diabetes, on how it impacts people with existing cardiovascular or pulmonary diseases, etc. So lots of opportunities here. There are a ton of ready-made resources available through the American Lung Association, as well as our other national partner organizations that are focused on helping people recover from tobacco addiction, American Cancer, and also American Heart Association, all great resources in the community, as well as going back to the quit line, back to the Department of Health for those evidence-based, ready-to-go materials. You don't have to recreate the wheel here. We have materials and resources available that can be integrated easily. Another key opportunity for enhancement, if your practice, if your organization is already doing screening, they're already providing referrals for care and treatment for recovery from tobacco dependence, there is an amazing opportunity to go the next level and integrate lung cancer screening. So we're very excited that the USPSTF has expanded recommendations on who can be screened. The American Lung Association and our national partners are rolling out additional guidance on how you can effectively integrate lung cancer screening and referral for screening into your practice. You can visit lung.org for more information on that, or stay tuned for more trainings coming out this fall from the American Lung Association. You can also visit savedbythescan.org to understand more about who qualifies for lung cancer screening, what it entails, and how you can access it or get more information for your practice or organization. Finally, looking at how we can best partner with community partnerships to support treatment integration and access to services. So this is key. Those partnerships are key to maintaining services, to increasing access and capacity. Going back again, those key foundations are key. So leadership buy-in, making sure that you find champions across the board. So champions for this work, both in care teams, in administration, champions in billing, champions in those community partners that your organization or practice might work with. Thinking about who do you work with on a daily basis, your vendors, your key partners, the people that you might refer out to for physical therapy or for imaging services. These are the key partners that you can build real sustainable relationships with that can also help to further enhance that whole person holistic wellness model. And then finally, engaging with your state's rural health association, the hospital association, the primary care association. Let's not forget about partnering with the state pediatric society or the thoracic society, GAMA, the Greater Albuquerque Medical Association. There are so many health organizations that are doing fantastic work across New Mexico, and that's true for every state as well. They all have different charters and chapters of these organizations that have common goals and objectives to yours, to helping people live better lives, to increasing quality improvement strategies and initiatives, and making sure that we are best leveraging the systems that we have in place. So thinking about making those strategic partnerships and aligning your work with their work can really help build capacity and really help people work smarter and not harder. And those relationships really matter. So meeting partners in efforts as to where they are. So if you are a public health folk that is, working on promoting these important measures to integrate treatment, understanding that every system is unique, different practices are unique, and meeting those key partners where they're at with the capacity that they currently have. There's always an opportunity to do more, to grow with where you're planted. So remember that there are experts on processes and system evaluation that are happy to help you understand how to make these enhancements with the tools at your disposal. Again, exploring those unique strengths, barriers, and organizational cultures is another key component of building relationships and partnerships to help you do this work. And understanding that in some settings, in some areas of our state, one provider might have multiple roles within an organization or within a practice. So again, meeting people where they're at with the capacity that they have. If you're a solo provider in rural New Mexico, you might be the provider, the receptionist, the billing expert, the IT expert, and the quality improvement team all in one. And we understand that, and we can help make those processes easier, and we can work together with you to help enhance the systems you have. So please don't hesitate to reach out to us at the American Lung Association, at Constellation Consulting, at NUPAC, New Mexico. We're all happy to work together and to help support you in this important work. And finally, we really covered a lot. So just a last couple of few wrap-up items here, and I hope you're walking away with some fresh inspiration on how you can enhance your EHRs, how you can modify them to provide these important services to those you serve. Again, information from NUPAC is critical, and they are ready to help you. So please don't hesitate to reach out to them. On the screen, there's a few key points that they can help you with if you are a medical provider or working within a system, big or small, how to leverage your EHR, how to meet Joint Commission standards, how to integrate those USPSTF guidelines for best practices in tobacco treatment, and how to ensure that you're providing effective evidence-based treatment for every patient, every time. Quick review here of those key components. And again, myself and my teammates at the American Lung Association are always here and happy to support you in your work. So please don't hesitate to reach out to us. We have additional resources for you and for the patients you serve, for your clients, your family members, and those in the community that you help support with better lung health. On the screen is my contact information. Please feel free to reach out to me or to our friends at Constellation Consulting if you have any questions about this training, about content, or if you have ideas for future trainings or deeper dives on any of this information. And finally, I've said it a few times throughout the training, but you can scan this QR code to access these training slides and get those resources that I've mentioned throughout so that you can take them back with you, discuss with your teammates, and really explore them on your own time, take a deeper dive into all of this great information. On the screen is contact information for Constellation Consulting of New Mexico and the New Mexico Health Equity teams. They are fantastic experts that can help you throughout the state of New Mexico. To request CEUs for this training, you can scan the QR code or visit the URL on the screen. A brief evaluation will get you access to your CEUs and certificate of completion. Thank you so much for your time today, your support, and for your work in advancing health equity across the state of New Mexico.